Thank you for joining us on Health Focus this week. And today we are sounding the bells of awareness towards diabetes because it is a very common non-communicable disease in Uganda. And for a fact, by 2021, about 89% of the people with diabetes in Uganda did not know that they have this condition. On top of that, they were not even on medication. And now that is a danger. That's what health workers tell us. And today I'm joined by Dr. Tom Bale from Mwesigye, Uganda, which many people know for HIV, but they do handle other things, including a diabetes clinic. Yes. Many people commonly know it as obroddewa sukari. But what about diabetes should the common person know out there?
Yeah, thank you very much. Diabetes mellitus, it's a chronic condition whereby the body does not produce enough insulin, or it does produce the insulin, but it is not using it effectively to control blood sugar levels. Insulin is a hormone in the body that helps to use the food we eat to produce energy. Or if it is not used for energy, it is stored for later use. So when the body does not produce enough of that insulin hormone, blood sugar levels rises in the body and they become toxic to the body, and that's what we call diabetes mellitus. Yeah.
So when someone has diabetes, what happens to their body?
Diabetes mellitus, because it causes high blood sugar levels, they damage the blood vessels and the nerves. So what happens when it damages the blood vessels that supply to the eye? It will cause blindness to an individual. So many times, that's why you will see many people with diabetes having a blurred vision. It's a form of blindness. And when it damages the blood vessels of your heart, it causes a heart attack. Even you can go into a stroke. And when it damages the blood vessels of your kidneys, it causes kidney failure.
We would also want to, clear the air about some misconceptions that I could stop taking sugar or I could stop taking a soda, but I find myself consuming a lot of honey because it is thought to be a replacement for sugar. Where does the good or bad sugar come from? Could a fruit have, sugar, or could it spike my sugar levels?
Ideally, in our body, it was automatically set to produce the insulin. We talked about that hormone to regulate the blood sugars when they are raised in the body, to lower them. But when it fails to lower them, that's when maybe you have now the increased blood sugar levels and to become toxic to the blood vessels and to your nerves. So sugar is sugar. There is no good sugar or bad sugar.
And we have been told that diabetes is actually a lifelong condition. You will need treatment or management for your entire lifetime. But we have had some stories that diabetes, first of all, can be prevented, but can be reversed at some point. What's the truth there?
Many people, if left unchecked in terms of lifestyle changes, if you're obese, you reduce your weight. If you're smoking, you quit smoking. In the next 5 years, if you don't do lifestyle modification, you're likely to develop typical diabetes mellitus. You're no longer now a pre-diabetic, now you're diabetic. And once you're diabetic, like as we said, the body's ability to produce the hormone insulin that regulates the blood sugar. Once you're there, it will be like that for the rest of your life, and you need to be on medication. People should be aware that once you are diagnosed to be diabetic, you will always be diabetic, and you'll be on medication for the rest of your life. When you have a metabolic recess, kindly regularly screen your blood sugar levels to be in check with them, so that you are not caught unaware on the metabolic storm that can come out of that.
So how do I check for diabetes?
Yeah, it is a simple check. We normally use finger pricks. There is a small instrument. It is sold in pharmacies, and you can use it on yourself. But when you cannot afford to buy that instrument, a device, you can go to the nearest health facility and you have your blood sugars checked. It's a finger prick. They get a small bit of your blood, put it on the device, and it reads automatically. In just 2 to 3 minutes, your results are good. And it reads your blood sugar levels in real time. Yes.
Okay.
Yeah, screening should be after 3 months. That's like 4 times in a year.
Yeah.
And at least every time you get an opportunity to go to the health facility. Yeah, it is an affordable test. Many laboratories, it's around 5,000 Ugandan shillings.
That's all we had for you this week. And like Dr. Tom Bale has told us, information is power. When you know, you can decide better. And like we learned in our primary schools, prevention is always better than cure. Don't wait to seek management and care. If you can't prevent, that's the best option. But we still have to know that diabetes affects everybody, including young children and even pregnant mothers. But when you know about it, prevention, or you seek better care and management, you will live a better life. My name is Walter Mwesigye. We'll see you next week.